Good afternoon, everyone. This we are Group 6 and I'll be representing the food economics. Economics is the efficient use of resources to meet the desirable goals. And food economics is the wise use of resources to provide food to people in the most cost-effective ways. With due consideration of health needs, cultural factors, legal regulations, food sanitation, safety available, raw materials, machinery, equipment, labor, and time. The principle of management with regards of 5 M's are the man or human resource, material, man-hour or time, method or technique, machinery or tools and equipment should be applied to maximize the conservation and utilization of food and water supplies. So, the food economics only study the whole process of the whole economic or the all economics, which is all it applies the people or all are and the machine, which is that can provide a food to all in a community. Next is food economics in relation to health economics. It is concerned with the development and application of the tools of economics and science to analyze healthcare problems, focusing on wise and effective allocation of resources. Covers the subdisciplines like food economics, pharmacoeconomics, health insurance, hospital administration, community healthcare systems, governmental control, modern family medical uh, practices, medical nutrition therapy, and alternative therapies. The food economics also relate to health economics, which is the main concern of the food economics is also the health of the individual. Food availability. Food availability is a geographical location and variation of climate. For example, the tropical areas are suitable for certain seasonal fruits and vegetables. The food availability it shows when, for example, if the food is be seasonal, it will be as suitable for certain, like in other area. The climate affects the production of the product. So the food availability will be also of effects on that. Agricultural factors, the fertility of the soil, production practices, example, crop rotation used for selected seeds, waste of use pesticides and fertilizer. The access to marine food sources, fin fishes, shellfishes, marine plants like algae or seaweeds are available from natural bodies of water. Means of transportation. The harvester from the sea or farm to processing plants distributed, retailers or directed to consumers. Knowledge of food preservation methods. Applying of food preservations. Advanced in food technology, methods of food processing and preservation. Marketing methods, kinds of providing venues for consumer so that the food is easily produced. Example, street vendors, house-to-house delivery, neighborhood stores, supermarkets, and farm or wet markets. Food security, accessibility to adequate nourishment at all times for all active health. Well known fact, the next to oxygen and water, food is the basic human need for survival. Biological roles of food include the alleviation of the effects of hunger, starvation, provision of calories for energy, and adequate intake of nutrients and essential for optimum health. Food is satisfaction of appetite and enjoyment of eating, which are covered under the social and emotional, physiological, and cultural dimensions of food. The food security means the individual must have met the adequate nourishment, and it must be provided uh, proper nutrients that can be help for active. Food security. The main dimension of food security are adequate food supply from farm and non-farm production, food availability and easy access, affordability, proper utilization, preservation, storage to avoid waste. And this is the uh, figure to show that food security, how the food security works. For example, the food supply, or example, or the food supply from the farm is not adequate, the food ability on will be also affected on that. It it will rise the prices, and it cannot be affordable for individual or families. Food security priorities from the word food summit, strengthening of family farming, the concentration of wealth and power must be reversed in action taken to prevent further concentration, agricultural and food production systems that rely on non-renewable resources, which negatively affect the environment, must be changed toward to a model based on agroecological sustainable principles. Responsibility of governments to improve food security and also to implement policies of poverty reduction and democratization. World Bank structural adjustment program should be suspended. The participation of people organizations at all levels must be strengthened. International law must be guaranteed the right to food, ensuring the food sovereignty takes precedence over macroeconomic policies, trade liberalization. Hunger and malnutrition are fundamentally questions of justice, unless we agree that the right of every human being is sustenance of life comes before the cause of the profit. The scourge of hunger and malnutrition will continue. Hunger and starvation. Hunger is the discomfort, weakness of the stomach due to lack of food. Prolonged starvation is the next consequence. Starvation diarrhea is significant. Result could be life-threatening. Food shortage occur predominantly in Asia, Africa, Latin America. The rate population of growth is increasing faster than the total amount of food produced to prevent hunger and starvation. In developing countries, population groups suffer from insecurity, such as homeless, very poor families, and jobless. The hunger, the difference of hunger and starvation. The hunger comes from uh, the lack of food or kakulangan ng nutrisyon sa katawan, which is nagre-result ng hunger. Pag tumagal ito or pag matagal siyang nag-occur yung hunger, magli-lead siya sa starvation, which is can lead to a complication just like malnutrition or even worse, death. Current and future trends. Current and future trends. Current and future trends with the rapid growth of high technology and trend of viewing health economics from the standpoint of political and business issues and not mainly its social impact, and the following are consideration hot topics. Global Nutrition Strategy. In April 2003, the Food and Agriculture Organizations, or FAO, and World Health Organization issued an expert report on diet, nutrition, and the prevention of chronic disease, results from study in 2001. Will serve as basis for the development of global nutrition strategy to combat the serious effects of chronic diseases that contribute about 60 to 57 million reported deaths in the world. The role of physical development. The World Organization stressed the importance of strong linkage among regional and national levels to implement the programs. Poverty and undernutrition. The dilemma of how to nourish the growing population at an acceptable level to sustain healthy active life versus the available and food and water supply continues to be controversial current global issues. Poverty is a single factor rather than food supply, the cause of hunger and undernutrition. There are approximately 80 million more feed each year, 97% which are low-income economically deprived countries. Factors that reduce food supply in addition to what have been mentioned previously are global warming, which may disrupt agricultural productions due to shifting of weather patterns and flooding of fertile soils by rising sea levels, reduction of availability of agricultural lands for cultivating plants and grazing needs of animals due to population growth and the housing demands. Food security is under threat due to various reasons, possible wars and food rise over scarce food supplies. Population growth rate is faster than food production. This explains that the poverty is the main reason this explained that the poverty can lead to hunger and undernutrition, which is the most affected of the hunger and undernutrition are mostly the low income or the economically deprived countries, just like Africa. Most sometimes the Philippines will be there because the Philippines will also uh, lacks in food supply. That's why sometimes we import another supplies from other country to have adequate food supplies for Filipinos. This also explains that the reasons why the reduced food supplies will be caused by the global warming. The first is the floods will also affect the soils and also the hot weather. The El Nino caused the drought, making the production make little, and also the agricultural land. Cause right now, some government prioritize the build, which is they didn't even know that it can affect the economics or the agricultural or the food production and the population that can be sometimes can be the supply will be low or at risk because of the economic or because of the build program that they have. And sometimes the obvious causes of crop failure are war, bad weather, civil or political strife, pestilence, plants, disease. Furthermore, food spoilage could reach as much as 20%, as estimated by the World Health Organization. This is a reminder to educators the importance of teaching households and communities suitable practical methods of food preservation, considering environmental condition, literacy levels, availability of tools, equipment, and budgetary allowance. This shows that the common causes of food hunger would be sometimes food spoilage, which is some people would love to make make more products or more food, and sometimes they don't eat that much, and it can and the food can and the food is not stored properly. It can lead to food storage or food spoilage. This figure shows the relationships among poverty, hunger, and undernutrition. On the other hand, the optimists think that advance of food technology and better agricultural techniques will result in increased food supplies. Also, an increase of income and decrease in family size by family planning programs are promising factors that will be balanced food supplies versus demand, which is, in my opinion, in my opinion, the this message that having a right family size or having a proper family planning will balance the food supplies. For example, in the urban area, or I would say uh, squatter area. I don't mean to discriminate someone, but in the squatter area, some people there has a kung, kung sino na nga yung maraming anak, sila pa yung naghihirap. Kasi naging mindset nila na pag madami kang anak, yun yung mabubuhay sa'yo pagtanda or magpapayaman sa'yo, which is wrong. That's why most of Filipinos have that kind of mindset, which is can lead to poverty, which is having a right or proper family planning programs. Like if a family has small children, the more that they can attend more or can attend more deep balance of supply, or at least they can have like not more have problem in food economies or food supply or food security. Future gains in food availability may be possible by reducing waste from irrigation, post-harvest losses, higher fertilizer uptake, and the use of seeds that yield more produce are water resistant and are resistant to plant disease. Organic farming without negative environmental side effects is receiving more acceptance now, although it has been practiced by some countries for the past decades. The Green Revolution. Before the advent of Green Revolution was the well-known period of the Green Revolution. The latter was based on the spread new rice varieties from the Philippines and new wheat, or the HYVS, or high yielding varieties from Mexico. The expertise originally came from scientists of developed countries with financial supports of Rockefeller and Ford foundations. In 1966, the Miracle Rice, propagated by the International Rice Research Institutes at Los Baños, Laguna, Philippines, after having collected many varieties of many varieties of rice from all over the world, of having studied breeding methods. In 1988, more semi-draft rice varieties are introduced by the RRIO. About 150 varieties that are more resistant to disease and bad weather yielded more harvests per acreage and were rapidly matured, thus having as many as 30 days become available. Unfortunately, some areas of the world had not benefited much from the Green Revolution due to other factors. The Green Revolution started in 1970s when commercial companies participated in crop and livestock improvements with the application of biotechnologies. Soybeans and corns or maize were the first crops of genetically modified foods. Genetic engineering as the process of manipulating deoxyribonucleic acid or DNA into plants, bacteria, or animals for beneficial results. This era is still in its early stage, and researchers are ongoing to study the pros and cons of biotechnology on food supplies. The proponents have listed the following benefits, especially for developing nations. Uh, for one, the increase of yield, or example of corn seeds genetically modified have 8% more yielded than the average seeds. Higher farm income. A study by National Center of Food Agriculture Policy, or NCJAP, released in 2002, revealed that the six biotech crops produce 6 billions additional pounds of food on the same acreage, which increased farm income by 1.5 billion. Improved nutritional quality of certain foods. Example, increase of amino acid and mineral contents, better taste, color, and texture. Popular examples are the bioengineered tomatoes, red peppers. They are also more resistant to plant disease through rotting. Prolonged shelf life because they are more resistant. All genetically engineered seeds are more stable than against rancidity. Opponents of using genetically engineered foods claims that they are may be disruption of natural ecosystems. The newly created microorganisms or plants may cause mutation or somehow harmful effects to the other plants, animals, or even to humans. There is need of consumer education presenting the pros and cons of the use of genetic engineer or application of genetic technology. More long-term researches will be needed on safe use of gene technology. Ultimately, the decision lies on the consumer, whose life and welfare are safeguarded by the health professional economies, govern, governmental and private agencies and industries. Concluding remarks. The problem of food economics need multi-phased approach. Social, political, commercial, cultural, legal, medical, and other related disciplines. Solutions to food securities, hunger, and undernutrition depends mainly on global network for funding as well as disseminating technological knowledge. The latter depends on researchers, support of the government and other institutions from both public and private sectors. See the table 6.8 showing the expenditures from agricultural research. High fuel costs also have resulted in higher agricultural costs or failing food stocks and large shift out of food production to produce biofuels. The problems in food economics can be multi-faced by the social, political, commercial, cultural, legal, medical, and other related. So, mostly the supply of the food. Sometimes the government is the problem because they don't support the political is the problem because they don't support the farmers. They they don't have enough support from they don't have a proper price for the farmers, and also the cultural, mostly the food economics can be the cultural can be problem in food economics because sometimes other culture doesn't, or other culture is far away from the urban area or sabayan. That's why sometimes the other culture suffer more. And sometimes the medical can be problem in food economics because sometimes the medical is not available in one barangay or in one municipality, which is can be more problem, can lead to health problems. The World Bank 2006 reported on repositioning nutrition as central development argues that there are long and short routes to improving nutrition. Higher incomes and better food security improve nutrition over longer terms, but malnutrition is not simply the result of food insecurity. Many children in food secure environments are underweight or stunted because of inappropriate infant feeding and care practices, poor access to health services, or poor sanitation. Much more attention, therefore, needs to be given to shorter routes to better nutrition, providing health and nutrition education and micronutrient fortification and supplementation. Till now, some of the areas in the Philippines uh, face some problem in malnutrition is because they don't have any proper education about health or food. How does the food affects on the health of individual? Sometimes the mother feed the infant a like coffee or ground rice coffee like that because they face a because they face kakulangan sa budget. Kaya mas minsan pinapractice nila yung ganun na kung ano lang yung makakaya nila, yun lang yung binibigay. Kaya minsan nagkakaroon ng problema sa malnutrition or nagkakos ng malnutrition. That's why the government provide health and nutrition education to every barangay and micronutrient fortification and supplementation. Equally important are conducting sound policy analysis, ensuring that the nutrition policies are linked to nutrition action, and developing appropriate capacity institutional arrangements to manage these programs, strengthening the commitment to tackling malnutrition and forging new partnerships. To do so are critical to making progress. Partnerships between governments, communities, and non-governmental organizations, between governments and the development partner community, and between governments, the corporate sector, whose role in fortifying food and taking responsible for the nutrition context of snacks and fast food and will be the central. That's it. Thank you. Okay.